from your local election headquarters. This is Politics Today with Jackie Kingston.
The monoclonal antibody treatment Regeneron has been offered to some COVID-19 patients in Amarillo for the better part of a year, but now even more people will have access to it. How medical professionals say this can help save lives and keep more people out of the hospital. And after a week filled with what Homeland Security Secretary Anthony Mayorkas characterized as horrible and horrific images from the Texas border, how the state and federal government are working together to find a solution to the influx of Haitian migrants looking for a better life. Good morning, everyone. Thanks for being here. The fight against COVID-19 continues, and here on the High Plains, we have access to another tool in the kit bag to help keep people out of hospitals and save lives. Monoclonal antibody treatments have been approved for emergency use by the FDA since November, but they're more widely available now here in Amarillo. This is in part thanks to our state's larger response to COVID-19 cases. The Texas Department of Emergency Management opened an additional antibody infusion center in Fort Worth, Houston, and Lubbock, as well as the one here in Amarillo now, too. The infusion center in Amarillo opened Thursday. It's at 808 South Johnson, kind of to the south and east of Hodgetown. The TDEM says the center will include personnel, equipment, supplies, and services for a 20-chair infusion center. The new center will be open from 8 to 8, 7 days a week. Here's who qualifies from Amarillo Public Health Director Casey Stoughton.
Referral. Patients will need to meet certain high-risk criteria and will need that physician referral to be screened and directed to the infusion center. Patients without a primary care physician, we still want them to be able to be served too. So Amarillo Public Health will be standing up a call center.
More on that now. Local health officials are encouraging high-risk COVID patients to seek out those Regeneron infusions. Politics Today's Kaylee Green has a reaction from local public health leaders who say the treatment is effective and keeps people out of our hospitals.
Amarillo Public Health Authority Dr. Todd Bell says the infusions that have been given out over the past 2 months have been the difference in preventing the Delta variant from overwhelming our hospital system.
If those patients who received those infusions had ended up in the hospital, I think that might have pushed us over the edge.
BSA's Chief Medical Officer Dr. Michael Lementier says they're being vigorous with Regeneron infusions in outpatient settings.
For the month of August, we did 466 Regeneron infusions. And primarily through our BSA Urgent Care Center. That team has done an outstanding job there of infusing patients, and I'm certain preventing many hospitalizations in the high-risk categories. And in September so far, through the first 13 days, this is as of last Monday, we had infused 263 additional patients.
Both he and Dr. Brian Weiss, the Chief Medical Officer at Northwest, say the infusions have been effective in preventing hospitalizations.
Just like last week, we got down to one ventilator left. Boy, preventing one hospitalization, one ICU makes a big difference. So this is a very effective intervention, and we really appreciate the city for setting this up for us.
Dr. Lementier says when studies were originally done on monoclonal antibodies, Delta wasn't the causative strain, but Regeneron is still working.
What we aren't seeing is the following. People who have received Regeneron, who are infected, who have lots of risk factors, meaning high risk for a severe course, showing up in the hospital a week later and needing to be hospitalized.
Dr. Lementier says the issue now is drug inventory. They will be working with the city's clinic to get more patients infused with Regeneron even more quickly. In studio, Kaylee Green, Politics Today. Jackie.
Kaylee, thank you. Stoughton says last winter the Public Health Department had an 8-bed unit. Now with 20 beds, they'll be able to give more infusions, especially since there have been changes to the way Regeneron is now administered. Let's take a look at the breakdown of patients who are not so lucky and who are in our area hospitals. This is the latest information as of Wednesday. Officials say in Amarillo, 11 patients in the area were waiting for beds in emergency rooms. These are people who are sick or injured, and they need to be admitted, but we literally don't have the beds available for them. Regionally, there are about 20 more waiting for hospitals to admit them. 14 are waiting for ICU beds, 9 have COVID-19. At Northwest Texas Hospital, they were dealing with 57 COVID-positive patients. 4 of those cases are expectant mothers. 7 patients are in the ICU. Northwest, again, as of Wednesday, had seen 26 deaths since the start of this month. Checking in now at BSA, it has 71 COVID-positive patients. 38 patients in the ICU, 18 on ventilators. They have 1 pediatric COVID patient. Down at the VA, they have 7 COVID positive patients, 4 in the ICU. Because of the high amount of patients, staffing concerns at Amarillo hospitals continue. According to the briefing this week, BSA says they have 19 staff members quarantined. They also hired 48 contract nurses and have 51 RAC nurses helping in their facility. Northwest Texas Hospital has 27 staff members quarantined. They've also hired more contract nurses and RAC healthcare workers, similar to what BSA has done. One of the ways we can help our healthcare workers and lower the curve at our area hospitals and make sure there's room for ourselves or our friends, our neighbors who are sick or injured in any way and need medical treatment is to get vaccinated, and a lot of people have. Take a look at this data. It's been kind of a comforting thing for me to look at this week. More than 60% of our state's population has been vaccinated, which is great. The vaccines and the antibody treatments can work to help save more lives. Let's take a look now at the majority of patients in Amarillo hospitals who continue to be unvaccinated individuals needing that medical treatment. According to the department's COVID-19 hospitalization report, 134 patients are currently hospitalized for COVID-19. 60 patients are in the ICU. 37 are on ventilators. 95% of patients in the ICU right now are not vaccinated. If you are already vaccinated, like I am, you might be waiting to find out when you might be eligible for or need a booster shot. We did have some news on that front this week. Transplant recipients and others with similar levels of compromised immunity can receive a 3rd dose of the vaccines from Pfizer and Moderna at least 28 days after getting their 2nd shot. And then on Thursday, the FDA authorized a 3rd dose for more Americans. The single booster dose is for senior citizens ages 65 and older, and for those age 18 through 64 who are considered to be in high-risk groups. The dose is expected to be administered to those who apply 6 months after they have finished their primary series. And we are still waiting for guidance on the Johnson & Johnson shot. That's the 1 dose. It's still being administered, but we'll continue to follow the guidance for that shot for you as well. In light of that news, the Centers for Disease Control and Prevention says more than 70 million vaccine-eligible Americans have yet to receive a shot. If you are one of those, you can head to the Amarillo Public Health Department on Monday through Friday of this week. You can head to 850 Martin Road for your Moderna or Pfizer vaccine. You do need to set up an appointment before you get your vaccine. If you don't want to set up an appointment, you can go to the mobile vaccine clinic. They'll be at Amarillo College's Washington Street campus from 9 to 5, Monday and Tuesday of this week. It is safe, it is effective. Get vaccinated. Another benefit to getting more people vaccinated is that we can maybe finally move on from this global pandemic. It's been wearing on all of our mental health, which is the next thing that I want to talk about this week here on the show. Coming up, how the pandemic is affecting the mental health of our community here on the High Plains. I'm Jackie Kingston. You're watching Politics Today from your local election headquarters.
We've all suffered. The United States has lost more than 670,000 of our fellow Americans. Worldwide, the death toll is above 4.5 million people. 4.5 million people. And this is a global tragedy. And we're not going to solve this crisis with half measures or middle-of-the-road ambitions. We need to go big, and we need to do our part. Governments, the private sector, civil society, leaders, philanthropists. This is an all-hands-on-deck crisis. And the good news is we know how to beat this pandemic. Vaccines, public health measures, and collective action.
President Biden saying that during a virtual global summit on COVID-19 from the White House Wednesday. The president announced that the U.S. is purchasing an additional 500 million doses of the Pfizer vaccine to distribute to low and middle income countries. But I also want to highlight one of the things that he said there. This is a global tragedy. It's likely that we all know someone who's gotten sick or maybe even died from this pandemic. And that's not an easy thing for any of us to process. During the past 20 months, many have felt overwhelmed by the pandemic. And experts say this is a critical time to take care of your mental health. Politics Today's Ali Cassetti shares how leaders from our medical community are speaking out on the importance of suicide prevention.
Even one suicide is too many.
The COVID-19 pandemic has had a devastating impact on everyone's mental health.
You'll hear lots of talk about COVID, but I want to remind people that September is Suicide Awareness Month. Right now, there are 1,900 people dying every day in the United States from COVID-19. There's 132 people who die from suicide in the United States every day. The difference is COVID's going to go away.
All too many have felt the pain firsthand that comes with losing a loved one to suicide.
I think we all have examples of either with family or friends or certainly coworkers where we can recount examples where we unfortunately lost someone who potentially could have been helped if we knew that they were suffering and were able to get them proper counseling services and or medical therapy.
And resulting from the pandemic, additional stress and depression.
What you do see is that increased isolation, the increased stress, increased fear of what's going on, as far as health factors and things like that.
Right now with the pandemic and particularly, we've seen skyrocketing rates of drug overdoses. So people turning to the medicine cabinet and taking medications if they're having a bad day or they're depressed or sad. We are seeing particularly high rates of suicidal overdose gestures in teenage girls.
So please don't hesitate to reach out. There are great resources and people on standby ready to help.
There are plenty of resources in this community to get yourself help, including the Behavioral Health Facility in the Northwest. If we can avoid the absolute devastation that occurs when someone takes their own life to their family and friends, we need to do that.
In Amarillo, Alex Setti, KAMR Local 4 News.
The number for the National Suicide Hotline is provided there on your screen below, 800-273-8255. Please know that you are not alone and there is help for you. Another news story that continues to be emotionally charged, the situation at our southern border. Coming up, we'll hear from the Texas governor and lawmakers who are thinking ahead about how to avoid this kind of situation in the future. I'll be honest with you, just because we know each other so well, I almost didn't show these photos this week, but this is the news. And to truly understand what happened at our state's southern border last week and to understand what's happening more broadly in our world, sometimes we have to acknowledge hard and uncomfortable things. And images like this should never be taken again after the practice of using horses was banned by the Border Patrol this week. The treatment of those more than 15,000 migrants from Haiti caused the special envoy to that country to resign. Haiti is facing the recent assassination of its president. It's working through the aftermath of a deadly and devastating earthquake, along with this global pandemic that we're all fighting. Some reports suggest that as many as 14,000 migrants crossed into the U.S. before agents began expelling plane loads of migrants from the area via repatriation flights last weekend. Texas Governor Greg Abbott is blaming mixed messaging from the Biden administration.
If you go back a year ago, President Biden campaigned on having open borders in the United States. I'm sure most people, when they heard President Biden, either when he was as a candidate or as president, talk about open borders, they had no idea it would lead to the type of chaos that we witnessed just behind me for day after day after day.
Most Haitians crossing the Rio Grande to the American side illegally will face deportation under the Title 42 public health law, which allows U.S. authorities to quickly return migrants to Mexico or their countries of origin. As of Thursday, the number of migrants at that border camp in Del Rio had been reduced to about 3,600 as federal authorities increased efforts to move them away from that bridge. That number peaked at around 15,000 last weekend. That's according to the Department of Homeland Security. For now, a temporary barricade of DPS trooper cars is blocking more people from crossing into Del Rio. Officials say many of them are being released in the United States with notices to appear in immigration court or to an immigration office. And that move seems to be against the Biden administration's public statements that the thousands in the camp faced immediate expulsion to Haiti if they tried to enter this country illegally. But how do we keep this from happening again? Politics Today's Monica Madden shows us how Texas lawmakers are wrangling with long-term solutions to prevent this kind of thing once more.
This isn't about Haiti. It's not about Haitians in Del Rio. This is much bigger.
Securing the border is an ever-present challenge for Texas.
Because this is decades in the making.
But scenes of the thousands of mostly Haitian migrants is prompting lawmakers and law enforcers to ask themselves, What is and isn't working? Director of DPS Stephen McCraw says the barricade of trooper vehicles blocking anyone from coming into Del Rio has kept more from crossing our border.
Well, we'll hold as long as necessary.
But that temporary solution takes away state troopers from their regular duties.
I would argue that it's always less safe when a trooper goes south.
Who'd ever thought we'd be at the border doing somebody else's job?
Finger pointing at the federal government still dominated a large portion of the hearing. But McCraw says there are things Texas can do.
Well, what about using temporary fences? Well, who can do it? Well, National Guard can do everything.
Yes, sir.
You know, really deterrence is they don't come across to begin with.
Okay.
And they don't come across because you've got a barrier there.
Okay.
That's what we did. Okay. We just put in a very expensive mobile barrier.
Democrats like Representative Eddie Morales say Texas lawmakers should de-incentivize the reasons people are coming into the U.S. illegally.
So if you hire somebody here illegally, we're going to fine you. It's going to be a state fine, and most of the people that are coming here illegally are coming because they're getting jobs.
Saying all the conversation around resources to the border misses the larger issue at hand.
But it's a drop in the bucket, man, until we change this side of the border.
In Austin, Monica Madden, KAMR Local 4 News.
So this is an interim committee. These lawmakers won't be drafting any bills to address border issues during the third special session, but it was an opportunity for the committee to talk about the challenges and some possible solutions for future legislative sessions. It was reported that as many as 20,000 additional migrants in Colombia are considering making the same trek as those Haitians did last week. Governor Abbott himself making a trip here to the High Plains next month. That's according to the Hutchinson County Republican Party. The governor will be in Borger October 1st, Friday. The reception will be held at Frank Phillips College Library. The governor was originally scheduled to visit Borger back in August, but was rescheduled after he tested positive for COVID-19. As you saw in the other stories we've covered in this block, the governor has recovered. He had very mild symptoms. The governor is vaccinated against COVID and received an antibody treatment, which again are both available in Amarillo and right now. We'll head to Canyon after this quick break, where WT is advocating for the future of life on campus. Coming up, how West Texas A&M University hopes to raise millions of dollars with the help of a monumental fundraising campaign. Welcome back. West Texas A&M University publicly launches what it's calling the largest fundraising campaign in Texas Panhandle history. They unveiled the university's comprehensive One West campaign at Buffalo Stadium in Canyon. The One West campaign will be the largest fundraiser the Panhandle has ever seen, with a goal of raising $125 million over the next 5 years. WT has already raised $80 million, which is 64% of that goal. University officials say the campaign will fuel their long-term plan, WT 125, from the Panhandle to the world. WT's Vice President for Philanthropy, Dr. Todd Raspberry, says the funds will impact not only the university, but the Panhandle as a whole.
So the $125 million will be an important impact. It will help create endowments. It will also provide funds for both current and existing programs that we want to expand to, programs that will address issues across the Panhandle and what it means to be a regional research institution. We take that very seriously.
The university says the funds raised from the campaign will be put into each part of the university. That includes each of the 6 colleges and the graduate school, from athletics to the Panhandle Plains Historical Museum, and anything under the WT umbrella can be funded through this campaign. The campaign will focus on people, places, and programs. Dr. Raspberry says the Growth University President Dr. Walter Wendler wants to see is people. His goal, he says, is to have 15,000 traditional students. More education news now. Amarillo ISD receiving more than $100 million to address the district's top spending instructional and learning priorities. The funds will be divided between each campus. More than $70 million coming from the ESSER 3 grant, more than $30 million coming from the ESSER 2 grant. AISD said some of its top priorities for the funds are addressing student learning loss, mental health support, and retention of staff. The district also created incentive programs for most staff members, including increased pay and bonuses for some as well. For more information on how Amarillo ISD will be spending that money to help your kids' school, go to myhighplains.com. We'll wrap things up here on Politics Today with some important dates to remember right after this. Something to put on your radar for this week. The Amarillo League of Women Voters is hosting a voter registration drive on Tuesday. They'll be at the downtown Amarillo Public Library from 10 to 1. They're preparing for the November 2nd election. On the ballot, a decision on a tax rate increase for the city of Amarillo and constitutional amendments for the state of Texas. The last day to register to vote is October 4th. Early voting begins October 18th. The last mail-in ballot application is due October 22nd. We have all those dates and times for you again on our website, myhighplains.com. Don't forget that you can follow along with us on social media. I'm on Facebook. I'm also on Twitter. I love your feedback. And myhighplains.com, of course, the way to stay up with all the latest political news throughout the week. Thank you so much for spending part of your Sunday here with me. I'll see you back here again next week.